Hi, I am Dr. N. Manjunatha, Additional Professor of Psychiatry working at National Institute of Mental Health and Neurosciences from Bangalore, India. I am going to talk on adapting a new nomenclature as a psychiatric examination in place of mental status examination. This video is appeal to all psychiatrists across the globe, and let's discuss in this video why this appeal can make sense to all of us. Let's see when mental status examination has originated. It is originated in 1918. Dr. Adolf Meyer, who was a Swiss born American psychiatrist, coined this term. Actually, he has given an outline for a standardized method, first time in psychiatry, to evaluate the patient's mental status in psychiatric practice. This was a major significant advancement in diagnostic process in the field of psychiatry at that point of time. This innovation by Mayer created a structured framework for psychiatrists who methodologically observe and document a patient's mental states, much like how a physician conducts comprehensive physical examinations. Overall, MSc has since served as a psychiatrist equivalent of physical examination. When mental status, the terminology was coined in 1990, it was under the psychiatry was under the influence of psychoanalytical and psychodynamic theory, and psychiatry was practiced within the boundary wall of mental asylum, lunatic hospitals, and mental hospitals. Now, current status of the psychiatry in last more than a century has undergone significant growth and development in biological aspect of psychiatric disorder, pharmacological advancement, and psychiatry has moved out of mental asylum to general hospital where psychiatrist has been practicing in integrated multi-specialty medical settings. Overall, psychiatry is now better understood as a branch of the medicine that deals with psychiatric disorders, abnormalities of the mind. And let's examine the criticism of mental status examination. The term mental in mental status examination faces a stigma, discrimination, negative connotation among the patient and their family and public, hindering the integration with the general medical practices. The term mental often associated with concepts like mental hygiene, mental health, suggesting the non-medical aspects, while psychiatry denotes a purely medical aspect. The stigma associated with the word mental suggests a division between the mental and physical health, potentially marginalize the psychiatric care. The term mental is also impede the integration of psychiatry in general medical practice, especially among the primary care doctors. The term mental within the mental status examination could be perceived as offensive, and status has potentially come with a static or rigid connotation regarding the psychiatric finding. In MSc, the term status suggests it is a one-time assessment, but we know that it is not a one-time assessment, it is a continuous evaluation throughout the interview. So the term mental and status in mental status examination having a negative meaning till date. Thus, in psychiatric research, the psychiatry signifies the disorder diagnosed by psychiatrists, while mental often intentional event created by people with the belief and desire assessed against the normative standards like rationality. Mental status examination in psychiatry also had received a challenge from two development. One from the tool called mini mental status examination, the namesake of mental status examination in MMSC, which is a screening tool used for assessing the cognition among the elderly people. It is a tool, but per se, it's not an examination in a psychiatry. And book called Stubborn Block's Mental Status Examination Neurology also contributed more confusion among the medical professionals. To clarify this, I categorize MSc into two sections as a cognitive and non-cognitive section of the MSc. Neurologists prioritize the cognitive section of the MSc, which assess the consciousness, orientation, abstract thinking, intelligence, and lobar test, which we better to refer as a higher mental functions. Psychiatrists primarily focus on non-cognitive mental status examination, covering the general appearance, behavior, speech, thought, emotion, and perception, which often indicates the psychiatric disorders. Cognitive aspect of MSc is the psychiatrist version, is a condensed version of what neurologists use. In simple, psychiatrists and neurologists focus on different aspects within the cognitive MSc, sections. Psychiatrists focus on a simpler task while neurologists handle more complex tasks across the various domains. And I'll just discuss the professional triplet in psychiatry. It's just the terminology, three terms: psychiatry, psychiatrist, and psychiatric examinations. How does it feel when you listen this? It gives a linguistic melody. It also gives a robust in vocabulary. Nice to listen, nice to write, nice to read, and also gives a natural flow in verbalizing about the medical specialty, and specific type of medical examination related to that specialty. I also feel that these professional triplet provide a better communication with our patients and their caregiver and between professionals and general public. Let's examine the prefix, root, and suffix in these triplets. And these three triplets, the prefix and roots are similar but with a different suffix. Prefix psych means mind or soul, and root is IATR, which means medical treatment. The psychiatry with its suffix. Psychiatry was coined in 1808 by a German physician, J.C. Riehl. The term psychiatry is derived from the Greek term psyche, meaning mind and soul. Aitria means healing. Literally, the word means medical treatment of the soul. So, psychiatry refers to medical treatment of the mind or soul. Let's see the suffix y, which means the act or process, or aitri, is suggesting the healing medical practices of the mind. Psychiatrist and its suffix ist indicates a physician. The word psychiatrist was first recorded between 1885 and 1890. The term psychiatry comes from Greek word psyche, which means mind or soul, or aitrias, which means healings. So psychiatry, atri means medical treatment. The suffix of the term psychiatric. The trick suffix dealt with medical practice of the psychiatrists. The suffix itric is used in adjectives to describe specific types of medical practices. The new terminology which I appealed all of you to use as psychiatric examination in place of MSc, which focuses on the mind, which conveys as a type of medical examination of the mind in the field of psychiatry, which is practiced by psychiatrists. I feel it conveys a better professional identity, much similar to triplets of other medical specialties like cardiology, neurology, and pulmonology, where cardiologist, cardiac examination, neurology, neurologist, neurological examination, pulmonology, pulmonologist, and pulmonary examinations. The advantage of psychiatric examination we should know before we call off. There is major advantage of replacing MSc with is the medical perspective in assessing the abnormalities of the mind or soul. A best professional identity with the natural advantage of professional triplets, which I described earlier, and integrate within the conceptual framework of the medical examination. Hence, it is easy to embrace in medical education and practice. Conveying that psychiatric examination is a medical examination, this is a unique advantage for psychiatrists to communicate with other medical professionals. And this also gives better communication with our patient, caregiver, public, and with policymaker, who often equate psychiatry with mental health. And hence, I appeal all psychiatrists across the globe to adopt and embrace nomenclature of psychiatric examination in place of mental status examination. I also urge medical authors who write their medical books to replace old nomenclature of MSc with psychiatric examination in their new and subsequent editions. I hope. Thank you very much for listening to my video. If you like it, please click the like button below. And please share among your psychiatric friends, colleagues, and psychiatric forum across the globe. I also welcome constructive criticism and comments in the comment section. And I would produce these kind of brainstorming videos. Please like my channel. And I also assure you that there will be prequel videos and sequel videos related to psychiatric examination in later dates. Please subscribe my YouTube channel to enjoy these kind of brainstorming videos. Thank you very much.